Hello, my name is Bertha, and this is week 4 MRI presentation. So the first question asks um, to explain what IV gadolinium is used for in MRI. So gadolinium is a chemical-based liquid that's very toxic and needs to be chelated in order to be used safely on the patient. And it's used in MRI because it enhances the appearance of certain pathologies such as cancer, infections, inflammations, things like that. And when it comes to gadolinium, some of the major concerns or potential complications could be one is the patient's if the patient has poor renal function because it can cause NSF. And if the patient has had previous allergic reaction that is pretty um, uh, fatal, like an allergic reaction towards like closing their airway, difficult breathing, chest pains, things like that. And also like if they have an allergic reaction such as hives and or rash. Some of the steps that we can take in a department to minimize each major concern is one is check the patient's creatine levels. It has to be 30 or above. And also check any previous history and then also going over their scanning form to see if they had previous allergic reactions and what type of reaction. So if you can see that they've had a previous exam in another facility and they've had a reaction, then you would just talk with the patients to explain exactly what type of reaction they had. If it was just hives, or if they actually, you know, um, their airway got like uh, swollen and they couldn't breathe or something like that. Um, and then if they have a heavy allergic reaction, then we give them an EpiPen. Or if they have like hives, a breakout of hives, then we would give them some Benadryl and and just keep track of the rash or hive on their arms or body. We'll make a little circle to make sure if the Benadryl is working. So if it's like getting smaller or it's still enlarging and spreading out the hives. Um, so basically, if um, a patient has any of these complications, it's very wise to remove them from um, this scanning room, which is zone 4, and bring them into the hallway right away if they're having an allergic reaction. And then that way, like a doctor or radiologist or nurse can come in and aid and assist care for them. And if a patient refuses to have the contrast, then you would just make a notation that patient refused contrast for the radiologist, and you may want to just kind of explain to the patient that the radiologist may or the doctor may want them to return for contrast, but in the meantime, we would continue on with the scan without the contrast, and then just kind of continue on there. So, in identifying the three main scan planes, there are coronal, sagittal, and axial. So for coronal, it divides the body into sections from anterior to posterior, so front to back. So for sagittal, it divides the body into sections left to right, so side to side. And for the axial plane, the body divides into the superior to inferior, so from top to bottom. So when it comes to MRI pulse sequences, a pulse sequence is exactly an orderly series of RF pulses and gradient applications that is repeated over and over in a sequence. The purpose is to create a signal into the receiver coil and over until K-Space has enough data for each slice in the series. And the data then is collected and it constructs a final image. And every clinical MRI exam consists of several different sequences in different scan planes. Um, so basically, you select a specific protocol based on the body part and the diagnose of the exam. And lastly, it's very important to take a notebook with you to your clinicals because you can write down information that the tech is showing you so you don't have to keep repeating the same question, and you can always refer to your notes. You can also write down the protocols down. You can basically, um, if you have questions that maybe there isn't time to ask, you can write your question down so that you can ask those questions later with the person that's training you in your clinicals. So that concludes my presentation. Thank you.